The hum of the engine and the endless ribbon of asphalt were John's world. For nearly 2 decades he'd been a long-haul truck driver, free but isolated. At 52, John prided himself on resilience, pushing through fatigue and solitude. When diagnosed with type 2 diabetes, he shrugged it off, letting prescriptions gather dust. His lifestyle, fast food, cigarettes, little exercise, was a perfect storm for diabetes. He ignored symptoms, blaming them on the job, always promising to change one day. But life on the road never slowed and his health quietly unraveled. John's story is a warning. Diabetes can't be ignored. Delay comes at a high price. John's first real warning was blurry vision, road signs and gauges fading into a haze. He blamed fatigue, but cheap reading glasses didn't help. Then came numb, burning feet and stubborn sores that wouldn't heal. Walking became painful. Even small cuts turned into ulcers. He lost weight without trying, felt exhausted and struggled to breathe after minor exertion. Chest pain crept in, but he pushed it aside. These weren't isolated issues, they were classic signs of advanced, uncontrolled diabetes. His body was no longer whispering, it was screaming for help. Years of neglect had set the stage for a crisis. High blood sugar is toxic, damaging blood vessels like shards of glass. Microvascular complications hit first. In the eyes, diabetic retinopathy blurs vision. In the kidneys, nephropathy leads to failure. In the nerves, neuropathy causes numbness and pain. John's foot problems and vision loss were direct results. Macrovascular complications follow. Hardened arteries raise the risk of heart attack, stroke, and poor circulation. His chest pain and foot ulcer were warning signs of this damage. Smoking and high blood pressure only made things worse. Uncontrolled diabetes poisons nearly every organ. Daily foot checks, regular eye exams, and blood sugar control are critical. Without action, the damage is relentless. John's crisis was years in the making. John arrived at the ER with chest pain and an infected foot. Tests revealed his diabetes was wildly uncontrolled. His HbA1c was double the healthy target. He had severe retinopathy, neuropathy, and early kidney failure. His heart arteries were dangerously blocked and his legs had poor circulation. The foot ulcer risked amputation. John faced a cascade of life-threatening complications, all rooted in neglected diabetes. His body was a textbook case of how hyperglycemia can devastate every system. The road he'd traveled led him to a hospital bed, fighting for his future. Why did John let it get this bad? The answer is complex. Long-haul trucking meant irregular hours, no time for doctor visits, and unhealthy food at every stop. Fast food and exhaustion made healthy choices nearly impossible. Social isolation and limited health knowledge left him without support or understanding. He didn't realize the seriousness of his symptoms until it was too late. John's story isn't rare. Many face similar barriers: demanding jobs, poor food environments, and lack of education. Managing diabetes takes more than willpower. It requires support, access, and knowledge. These barriers must be addressed to prevent more tragedies. John's case is a call to action for better care and awareness. John's crisis was a turning point, not the end. He started insulin, blood pressure, and cholesterol medications immediately. Specialists treated his eyes, foot, and kidneys, while a team coordinated his care. Diabetes educators and dietitians taught him to monitor sugar, eat better, and stay active, even on the road. Support groups helped him fight isolation. The journey ahead is tough, but hope remains. If you have diabetes, don't wait for a crisis. Manage it early and consistently. See your doctor, take your meds, eat well, and stay active. Learn about your condition and ask for help. With the right tools and support, diabetes can be managed, and life can go on.